Professor Blumberg, thank you so much for talking to us tonight. Let's just begin here. Is there enough information, particularly when it comes to the patients that have tested positive and how they should, re-enter society, and even particularly for those that are also going to be interacting with them?
So, good evening and thank you very much. I think what we're talking about tonight is people who are infected with COVID-19 virus, who are isolated for a period of now 10 days, and you want to bring them back into the workplace or into family or other settings. So, I think some of the others on the panel could talk about people coming back into this setting. I think we need to just mention what is isolation, and perhaps that's a good place to start. Isolation is separation of a person who is infected or likely infected with the COVID-19 virus for a period of time, separation from other people so that you reduce or stop the chances of this person infecting others. And it used to be 14 days. It's now reduced to 10 days. And I think it's based on really growing information that people who are infected with the virus are probably infectious for about eight or so days. And I think previously the 14 days was based on what we thought was right, but I think we have much better information now on the period of being infectious. So 10 days is absolutely safe.
And Professor Blumberg, some have argued that this then adds to the anxiety of, their colleagues, or even some of those that have to receive them back as they re-enter into society. What do you then say to that? Because some people are saying that their anxiety levels are skyrocketing now that they know that that isolation period has been reduced.
So it was, it was 14 days. I think we know now from a lot of work done on infected patients that the highest amount of virus is present early in the illness, on day 1 or day 2, or even the day before they present with symptoms, and that it gradually decreases, and that by 8 days, you can, if you do culture, if you try and culture the virus from the respiratory secretions, in fact, you can no longer do so. And so they are no longer infectious by 8 days. I think we're adding, in the majority of cases, we're adding 2 days for, just being extra safe. But really, they are not infectious by 10 days, and they're perfectly safe to return to their previous places of where they live or where they work. So I really want to reassure you about that. Highest chance of infection is early in their illness.
And Professor Blumberg, what then do you say? I know that you're saying that, of course, you can reassure people that the infection rate, and they're highly infectious in the beginning, and, they can re-enter into society. But what about them? What about the patients themselves? What do you say to them as they re-enter, society again, particularly when it comes to going back to doing the things that you would have been doing, either go to work, either start, if you were somebody that would go jogging, how do you then start doing that again?
Well, firstly, they pose no risk to anybody. I think we need to separate perhaps people into those who were perhaps just tested by chance, who had no symptoms, those who had mild illness, and those who had more complicated illness. So it's 10 days for those who tested but didn't have any symptoms, and they will be absolutely fine. It's also 10 days from the onset of illness to those who had mild illness. And certainly we know that even after 8 or 10 days, they may still have some symptoms. They may still have some cough. They may be very tired. So you spoke about jogging. They may not be able to go back to that immediately, but they're non-infectious. When you look at people who may require admission to hospital and who may require oxygen or other support for their illness, it's 10 days after they no longer require oxygen. So it really depends. That period depends on how ill you are. And we know that for people who have more severe illness, who do require oxygen, who may require other support for their breathing, they may be infectious for longer. So it's 10 days from when they no longer require that oxygen. So it is a little longer. And they will definitely need a period of longer rehabilitation. They may not be able to go back to work immediately and take up what they were doing, depending on what their work was. And there will be a period, like with many viral illnesses, where you feel tired. You may not be able to resume all the exercise you do. You may need to rest and gain your strength. I think that would not be unusual. And so it's to ease back gently and to be kind to yourself. And it's the period of 10 days is the de-isolation. It doesn't refer to, well, you can take up everything you did before. That's that's an assessment that some patients can say, I'm not quite ready for that. If they had severe illness, they may need a medical examination to say, well, you can go back to what you were doing. But any viral infection, there needs to be a period of rest and, don't think it's time for excessive exercise.